Your heart is not just a vital organ that pumps blood throughout your body, it's the very essence of life. The health of your heart is a cornerstone of your overall well-being, influencing every facet of your existence. It's the engine that keeps your body running smoothly, and it deserves your utmost care and attention. Heart disease remains a leading cause of death globally, and its prevalence is a clear reminder of the importance of taking charge of your heart health. This guide is your comprehensive resource for understanding, protecting, and nurturing your heart, whether you're looking to prevent heart issues, manage existing conditions, or simply live a heart-healthy life. The knowledge and practices outlined here will empower you to make informed decisions. In this guide, we'll delve into the intricate workings of your heart, explore the risk factors that can compromise its health, and provide practical steps to safeguard your cardiovascular system. You'll discover how lifestyle choices, such as diet, exercise, and stress management, play a pivotal role in nurturing a strong, resilient heart. We'll discuss how to recognize and reduce risk factors, including the impact of genetics, lifestyle choices, and environmental factors. Your journey to a healthier heart begins with knowledge. By the end of this guide, you'll understand the anatomy and function of your heart, recognize the red flags of heart disease, and be equipped with the tools and strategies to prioritize heart health. You'll also find resources for ongoing support and education, ensuring that your heart's well-being remains a lifelong commitment. Remember, your heart is your most loyal companion, working tirelessly day and night. It's time to return the favor by dedicating yourself to the care and protection of this incredible organ. So, let's embark on this journey together, and explore the steps you can take to ensure your heart remains a strong and steadfast companion throughout your life. Understanding your heart, anatomy of the heart. The heart, often described as a symbol of love and emotion, is an intricate organ crucial for sustaining life. To truly care for your heart, it's essential to understand its anatomy and how it functions. This knowledge not only fosters appreciation for this remarkable organ, but also empowers you to make informed decisions about your cardiovascular health. The heart's position. The heart is located in the chest, slightly to the left of the center. It's nestled between the lungs and protected by the rib cage. This position provides it with the necessary protection while ensuring efficient blood flow. Size and shape. Your heart is roughly the size of a clenched fist and has the shape of an inverted cone. It's approximately 5 inches in length, 3.5 inches in width, and 2.5 inches in thickness. 4 chambers. The heart consists of 4 chambers. The 2 upper chambers are called atria, while the 2 lower chambers are known as ventricles. The right atrium and right ventricle receive and pump blood to the lungs, while the left atrium and left ventricle distribute oxygenated blood throughout the body. Valves. The heart is equipped with 4 valves that control the flow of blood. The atrioventricular (AV) valves, the tricuspid and bicuspid mitral valves separate the atria from the ventricles. The semilunar valves, the aortic and pulmonary valves, regulate blood flow out of the ventricles. Coronary arteries. The heart has its blood supply through the coronary arteries. These arteries wrap around the heart and provide it with the nutrients and oxygen it requires to function effectively. The pericardium. Surrounding the heart is a thin, double-walled sac called the pericardium. This sac protects the heart and provides a lubricating fluid that reduces friction as the heart beats. Electrical conduction. The heart has its electrical conduction system, which controls the heartbeat. This system includes the sinoatrial (SA) node, the atrioventricular (AV) node, and the bundle of His, ensuring the heart contracts rhythmically. Blood flow. The heart is at the center of a vast network of blood vessels. Deoxygenated blood from the body returns to the right atrium, flows into the right ventricle, and is pumped to the lungs to receive oxygen. Oxygenated blood then enters the left atrium, travels to the left ventricle, and is distributed to the entire body. Cardiac cycle. The cardiac cycle refers to the sequence of events that occur during one heartbeat. It includes systole, the contraction phase when the heart pumps blood, and diastole, the relaxation phase when the heart fills with blood. Heart wall. The heart's wall consists of 3 layers: the epicardium, outer layer, the myocardium, middle, muscular layer, and the endocardium, inner lining. These layers work together to facilitate the heart's pumping action. The heart's workload. The heart is a tirelessly active organ, beating around 100,000 times a day and pumping about 2,000 gallons of blood daily. This makes it one of the hardest working muscles in the body. Function as a pump. The heart acts as a pump, maintaining a continuous circulation of blood, delivering oxygen and nutrients to the body's tissues, and removing waste products. Heart sounds. You can hear the heartbeat as 2 distinct sounds, commonly referred to as loop-dub. These sounds are produced by the closing of the heart's valves during each heartbeat. Cardiac output. Cardiac output is a measure of how much blood your heart pumps in 1 minute. It's determined by the heart rate, beats per minute, and the stroke volume, the amount of blood pumped with each beat. Lifelong vigilance. Understanding the anatomy of the heart is the first step in maintaining cardiovascular health. It is a lifelong journey of care, as your heart continues to beat and serve as the foundation of your overall well-being. In comprehending the intricacies of your heart's anatomy, you are better prepared to appreciate its significance and take proactive steps to keep it healthy. This knowledge is the foundation upon which you can build a lifetime of heart-healthy choices and practices. Let's delve even deeper into the anatomy of the heart. Blood supply to the heart. The heart, despite its role as a pump, also requires a constant supply of blood to nourish its own tissues. This supply is delivered by the coronary arteries, which branch out across the heart muscle. The heart's muscle cells. The heart's muscular walls are composed of specialized muscle cells called cardiomyocytes. These cells contract in unison, generating the force needed to pump blood. Heart's weight. The heart may weigh around 250 to 350 grams in an average adult, but its workload can cause the heart to pump several tons of blood every day. Heart development. In the early stages of embryonic development, the heart begins as a simple tube. As the fetus grows, this tube folds and develops into the 4-chambered organ that sustains life after birth. Role of heart's valves. The heart valves are crucial for maintaining the one-way flow of blood. The atrioventricular (AV) valves prevent backflow from the ventricles to the atria, while the semilunar valves stop blood from returning to the ventricles after it's been pumped out. The cardiac conduction system. The heart's electrical conduction system ensures that electrical signals are transmitted at the right time, coordinating the contraction of the atria and ventricles, which is essential for efficient pumping. Adaptations to exercise. Over time, the heart can adapt to increased physical activity. Regular exercise can lead to a more efficient heart, capable of pumping a larger volume of blood with each beat. Size variations. The size of the heart can vary from person to person. It may be influenced by factors like age, gender, genetics, and physical fitness. Heart rate variability. A healthy heart demonstrates variability in its rhythm. It's not a metronome, instead, it adapts to the body's needs, slowing down during rest and speeding up during physical activity or stress. Emotional connection. Beyond its physiological significance, the heart has a deep emotional connection. It's often associated with love, courage, and the center of one's being, making it a symbol of human emotions and connections. Understanding the intricate anatomy of the heart is more than just a matter of biology. It's about appreciating the incredible machinery that keeps us alive and knowing how to care for it. This knowledge empowers you to make choices that support your heart's function and overall well-being, laying the foundation for a heart-healthy lifestyle. How the heart works. Understanding the mechanics of how the heart works is vital in appreciating the significance of its function and the importance of its care. The heart is an incredibly efficient and robust pump, continually circulating blood throughout the body. Here's a detailed look at how this vital organ operates. 1. The heart as a pump. At its core, the heart is a muscular pump. Its primary function is to ensure a continuous flow of blood, transporting oxygen, nutrients, and essential substances to every cell in the body. 2. Blood return. Deoxygenated blood, laden with waste products, returns to the heart via two large veins, the superior and inferior vena cava. The blood enters the right atrium, setting the stage for the heart's operation. 3. Atrial contraction. The right atrium contracts, pushing blood into the right ventricle. Simultaneously, the left atrium receives oxygenated blood from the lungs and pushes it into the left ventricle. 4. Ventricular contraction. The right ventricle contracts, sending deoxygenated blood to the lungs for oxygenation, while the left ventricle contracts, propelling oxygen-rich blood out to the rest of the body. 5. The role of valves. Heart valves play a pivotal role in ensuring one-way blood flow. The tricuspid and mitral, bicuspid, valves separate the atria from the ventricles, while the aortic and pulmonary valves prevent backflow from the ventricles. 6. Systole and diastole. The heart operates in a rhythmic pattern known as the cardiac cycle. Systole is the contraction phase, during which blood is pumped out of the heart. Diastole is the relaxation phase, allowing the heart to refill with blood. 7. Cardiac output. Cardiac output is the volume of blood the heart pumps per minute. It's determined by heart rate, the number of beats per minute, and stroke volume, the amount of blood ejected with each beat. 8. Electrical signals. The heart's beat is governed by electrical impulses. The sinoatrial (SA) node generates electrical signals, triggering the heart's contractions, and the atrioventricular (AV) node coordinates the timing between the atria and ventricles. 9. Blood distribution. Oxygenated blood, pumped from the left ventricle, is distributed through a network of arteries that gradually branch into smaller vessels. Deoxygenated blood, returning to the right atrium, is sent to the lungs for oxygenation through the pulmonary arteries. 10. Continuous cycle. This remarkable process is a continuous cycle. The heart beats around 100,000 times a day, ensuring that every cell in the body receives the oxygen and nutrients it needs. Even during sleep or rest, the heart never takes a break, emphasizing its role as the ceaseless guardian of life. Understanding the intricacies of how the heart works underscores the significance of maintaining its health. This video provides the foundation for making lifestyle choices that support and preserve the heart's efficient operation, ensuring a lifetime of cardiovascular well-being. Risk factors for heart disease, genetics and family history. Heart disease can often be influenced by both genetic factors and family history. Understanding these risk factors is essential for assessing your cardiovascular health. Here's an in-depth look at how genetics and family history can impact your risk of heart disease. 1. Genetic predisposition. Genetics can play a significant role in your risk of heart disease. Some people inherit genes that make them more susceptible to certain heart conditions, such as coronary artery disease or arrhythmias. 2. Familial hypercholesterolemia. This is an inherited condition that leads to high levels of LDL, bad cholesterol. It significantly increases the risk of atherosclerosis and heart attacks. 3. Genetic mutations. Certain genetic mutations can affect blood clotting, which may increase the risk of heart attack and stroke. 4. Family clustering. A family history of heart disease can indicate a genetic predisposition. If close relatives have had heart attacks, strokes, or other heart-related issues, your risk may be elevated. 5. Early onset. If a family member developed heart disease at an early age, before 55 for men and 65 for women, it may indicate a genetic link that heightens your own risk. 6. Shared lifestyle. Families often share not only genes, but also lifestyle habits. Unhealthy behaviors, like poor diet and lack of exercise, can contribute to a family history of heart disease. 7. Genetics and hypertension. Genetic factors can influence blood pressure regulation. If your family has a history of hypertension, you may be at an increased risk of heart disease. 8. Inherited conditions. Some genetic conditions, like Marfan syndrome, can impact the structure and function of the heart, increasing the risk of heart disease. 9. Genetic testing. Genetic testing can identify certain mutations or conditions that may increase your risk. It can be a useful tool for individuals with a strong family history of heart disease. 10. Awareness and prevention. Understanding your genetic risk is not a guarantee of heart disease, but serves as a valuable awareness tool. Knowing your risk factors can motivate you to adopt a heart-healthy lifestyle, which can offset genetic predisposition to some extent. While genetics and family history can influence your risk of heart disease, it's important to remember that these factors are just one piece of the puzzle. Your lifestyle choices, including diet, exercise, smoking habits, and stress management, also significantly impact your heart health. By being proactive and making heart-healthy choices, you can mitigate the impact of genetic and family-related risk factors and lead a longer, healthier life. Risk factors for heart disease, in relative to lifestyle factors. In addition to genetic and family history factors, lifestyle choices play a substantial role in the development of heart disease. Understanding these modifiable risk factors is crucial for maintaining a healthy heart. Here's an in-depth exploration of how lifestyle factors can influence your risk of heart disease. 1. Diet. Unhealthy eating habits high in saturated and trans fats, cholesterol, sodium, and added sugars can contribute to heart disease. A diet rich in fruits, vegetables, whole grains, and lean proteins can promote heart health. 2. Physical inactivity. A sedentary lifestyle is a significant risk factor for heart disease. Regular physical activity helps maintain a healthy weight, lower blood pressure, and improve heart function. 3. Smoking. Smoking is one of the most significant risk factors for heart disease. It damages blood vessels, increases blood pressure, and reduces the oxygen-carrying capacity of the blood. 4. Obesity. Excess body weight, especially when it accumulates around the abdomen, increases the risk of heart disease. Obesity can lead to conditions like hypertension and diabetes, which are linked to heart problems. 5. High blood pressure. Hypertension, or high blood pressure, is a major risk factor for heart disease. It strains the heart and arteries, increasing the likelihood of heart attacks and strokes. 6. High cholesterol. Elevated levels of low-density lipoprotein, LDL, cholesterol, often referred to as bad cholesterol, can contribute to the buildup of plaque in the arteries, increasing the risk of atherosclerosis and heart disease. 7. Diabetes. Diabetes, especially type 2 diabetes, is closely associated with heart disease. High blood sugar levels can damage blood vessels and increase the risk of cardiovascular issues. 8. Excessive alcohol consumption. While moderate alcohol consumption may have some heart benefits, excessive drinking can lead to high blood pressure, heart failure, and other heart-related problems. 9. Stress. Chronic stress can lead to unhealthy coping mechanisms, such as overeating or smoking, which increase the risk of heart disease. It can also directly impact heart health by elevating blood pressure and promoting inflammation. 10. Poor sleep. Sleep deprivation and untreated sleep disorders, like sleep apnea, can disrupt the body's natural rhythms and increase the risk of heart disease. 11. Unmanaged mental health. Conditions like depression and anxiety have been linked to heart disease. The physiological responses to these conditions, such as elevated cortisol levels, can harm the heart. 12. Excessive salt intake. A diet high in sodium can lead to high blood pressure and an increased risk of heart disease. Reducing salt intake is an essential part of heart-healthy eating. 13. Alcohol and drug abuse. Substance abuse can harm the heart and lead to cardiovascular problems. Illicit drugs and excessive alcohol can damage the heart and blood vessels. 14. Inadequate hydration. Dehydration can strain the cardiovascular system and increase the risk of heart issues. Staying adequately hydrated is essential for heart health. 15. Medication non-adherence. Failing to follow prescribed medication regimens for conditions like high blood pressure or high cholesterol can increase the risk of heart disease. By recognizing and addressing these lifestyle factors, you can actively reduce your risk of heart disease. Engaging in heart-healthy behaviors, such as maintaining a balanced diet, regular exercise, and stress management, can significantly enhance your cardiovascular health and overall well-being. Let's discuss the risk factors for heart disease, focusing on medical conditions, and stress and mental health. Medical conditions. Metabolic syndrome. Metabolic syndrome is a cluster of conditions, including obesity, high blood pressure, high blood sugar, and abnormal cholesterol levels. Together, they significantly increase the risk of heart disease. Inflammatory conditions. Chronic inflammatory conditions, such as rheumatoid arthritis and lupus, can contribute to inflammation in the body, which may increase the risk of atherosclerosis and other heart issues. Sleep apnea. Sleep apnea, characterized by interrupted breathing during sleep, can lead to low oxygen levels and high blood pressure, increasing the risk of heart disease. Chronic kidney disease. Kidney disease is closely linked to heart disease, as damaged kidneys can lead to imbalances in electrolytes and increased blood pressure. Autoimmune diseases. Conditions like systemic lupus erythematosus, SLE, and psoriasis can have systemic effects, including inflammation that can damage the heart. Stress and mental health. Chronic stress. Prolonged exposure to stress can lead to a heightened release of stress hormones like cortisol, which can raise blood pressure and promote inflammation, increasing the risk of heart disease. Anxiety disorders. Conditions like generalized anxiety disorder and panic disorder can lead to elevated heart rate and blood pressure, which, when chronic, can contribute to heart issues. Depression. Depression is associated with an increased risk of heart disease, partly due to changes in behaviors and biological factors like inflammation and autonomic nervous system dysfunction. Social isolation. Loneliness and social isolation can have a negative impact on mental health and contribute to unhealthy behaviors, such as poor diet and lack of physical activity, that increase heart disease risk. Coping mechanisms. People under stress or dealing with mental health conditions may turn to unhealthy coping mechanisms, like smoking or excessive alcohol consumption, which can be detrimental to heart health. Addressing medical conditions and mental health factors as risk factors for heart disease is crucial. Individuals with these risk factors should work closely with healthcare professionals to manage their conditions effectively and implement heart-healthy strategies. Stress management, regular checkups, and seeking emotional support when needed are key steps in maintaining cardiovascular health and overall well-being. Maintaining a healthy heart involves not only understanding risk factors, but also vigilant monitoring of your cardiovascular well-being. Regular checks and assessments are key to early detection and prevention. Here are crucial aspects of monitoring heart health. Regular checkups. Annual checkups with a healthcare provider are essential. These visits can help detect early signs of heart disease, assess risk factors, and establish a baseline for your heart health. Blood pressure. Regular blood pressure monitoring is critical. High blood pressure, or hypertension, is a significant risk factor for heart disease. Tracking your blood pressure at home and during doctor visits can help manage this risk. Cholesterol levels. Monitoring your cholesterol levels, especially LDL, bad cholesterol, and HDL, good cholesterol, is crucial. High LDL cholesterol levels contribute to the buildup of arterial plaque. Regular cholesterol tests can guide dietary and medication choices. Heart rate and rhythm. Monitoring your heart rate and rhythm can uncover arrhythmias or irregularities. Tools like heart rate monitors or wearable fitness devices can help track your heart's performance during exercise and at rest. Blood glucose. For individuals at risk of diabetes or those with the condition, regular blood glucose monitoring is important. Elevated blood sugar levels can damage blood vessels and increase heart disease risk. Weight management. Regularly monitoring your weight and body mass index, BMI, can help track progress toward maintaining a healthy weight reducing a major risk factor for heart disease. Physical activity. Keeping track of your physical activity is essential. Regular exercise helps maintain heart health. Logging your workouts, even simple activities like walking, can encourage regular movement. Stress management. Regularly evaluating your stress levels and practicing stress reduction techniques, like meditation or yoga, can mitigate stress-related impacts on the heart. Medication adherence. If you're on medications for heart health, such as blood pressure or cholesterol medications, it's crucial to adhere to your prescribed regimen. Regularly check your medication supply and take it as directed. Family history updates. Periodically update your family history of heart disease. Changes in your family's medical history can impact your risk, so be sure to inform your healthcare provider. By proactively monitoring these aspects of your heart health, you can take charge of your cardiovascular well-being. Regular checkups and tracking of vital indicators allow for early intervention and the implementation of heart-healthy strategies, reducing the risk of heart disease and promoting long-term wellness. Various aspects of maintaining a healthy heart. Medications and treatment for heart health. Medications play a vital role in managing heart health. Depending on your specific condition, your healthcare provider may prescribe medications to control blood pressure, reduce cholesterol levels, manage diabetes, or prevent blood clots. It is essential to take these medications as prescribed and to communicate regularly with your healthcare provider to ensure they are effective and well tolerated. Surgical procedures for heart health. In cases of advanced heart disease, surgical procedures may be necessary. Common heart surgeries include coronary artery bypass grafting, CABG, angioplasty and stent placement, valve repair or replacement, and heart transplant. Surgical interventions aim to restore blood flow, repair damaged heart valves, or replace a failing heart to improve overall cardiac function. Rehabilitation and recovery. After a heart surgery or cardiac event, cardiac rehabilitation is essential for a full recovery. This program involves supervised exercise, lifestyle counseling, and support to help individuals regain strength and confidence. It can also provide education on heart-healthy living and stress management. Lifestyle tips for a healthy heart. Maintaining a healthy lifestyle is paramount for heart health. Here are some essential lifestyle tips. 1. Maintaining a healthy weight. Excess weight places added stress on the heart and increases the risk of heart disease. Achieving and maintaining a healthy weight through a balanced diet and regular physical activity is crucial. 2. Limiting sodium intake. Excess salt, sodium, in the diet can lead to high blood pressure. Reducing sodium intake by limiting processed foods and using herbs and spices for flavor can help maintain healthy blood pressure levels. 3. Tips for dining out. When dining out, choose heart-healthy options. Opt for dishes that are grilled, baked, or steamed, and avoid those high in saturated fats and excessive salt. Ask for dressings and sauces on the side to control your intake. 4. Healthy cooking at home. Cooking at home allows you to control the ingredients and portion sizes. Use heart-healthy cooking methods like baking, grilling, and stir-frying with healthy oils like olive oil. Incorporate plenty of vegetables, whole grains, and lean protein sources into your meals. 5. Regular physical activity. Engage in regular physical activity, such as brisk walking, swimming, or cycling, to improve cardiovascular health. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. 6. Smoking cessation. Smoking is a significant risk factor for heart disease. If you smoke, quitting is one of the most important steps you can take for your heart health. There are various support programs and medications available to help you quit. 7. Manage stress. Chronic stress can contribute to heart disease. Employ stress management techniques like meditation, deep breathing exercises, or engaging in hobbies to alleviate stress. 8. Regular check UPS. Regular checkups with your healthcare provider are essential for monitoring your heart health. These visits can help detect and manage risk factors such as high blood pressure, high cholesterol, and diabetes. 9. Alcohol in moderation. Limit alcohol consumption to moderate levels, as excessive alcohol intake can lead to heart-related issues. For men, this typically means up to 2 drinks per day, and for women, 1 drink per day. 10. Sleep. Quality sleep is essential for heart health. Aim for 7 to 9 hours of sleep per night to support overall well-being. In conclusion, maintaining a healthy heart is a lifelong commitment that involves a combination of medical care, lifestyle choices, and preventive measures. Prioritizing heart health through regular checkups, a heart-healthy diet, physical activity, and stress management can significantly reduce the risk of heart disease and contribute to a longer, healthier life.